I'm Andy Canops of Canops Equine. Today we're going to discuss physical examination of the horse. There are several reasons why a physical examination may be undertaken on your horse. One would be just a general wellness exam to determine whether the horse organ function and general health is good or not. Other reasons for a physical exam include an insurance examination, a health certificate for transport or movement to showgrounds, or for a part of a pre-purchase evaluation. As we start the physical examination, the most important part is to evaluate the horse free of handlers or me grabbing a hold of the horse right away. Seeing it free in the stall is a great advantage, because when the horse is relaxed, you get a good appreciation for the general well-being or not of the horse. As we look at the horse from a bit of a distance, I oftentimes ask history. What has the horse been doing? What's the appetite like? Does the horse show any lameness? Is there a cough? Any changes in feed or behavior of the horse? Then we start with the direct physical exam. I usually start by taking a rectal temperature. That is a really important part of an exam, whether you do it yourself on farm or your veterinarian undertakes it. An elevated temperature may indicate illness, inflammation, or disease. From there, we evaluate the cardiovascular system by looking at the gums, and we assess gum color, which normally should be pink, and the gums should be moist rather than dry. Then we press the gums to determine what's called capillary refill time, and that's an assessment of the cardiovascular system to see that blood is flowing to all the parts of the body in appropriate fashion. Normal capillary refill time is 2 seconds or less. Then we'll take the stethoscope and listen to the heart and the lungs. We listen to the heart for rhythm, which should be normal without murmurs or major skips in the rhythm. And then listen to the lungs to hear air movement, which normally would be clean and without raspiness or rough sounds that we call rails. Then we move back and listen to gastrointestinal motility by putting the stethoscope on the abdomen in 4 different quadrants, high and low on the left and the right side. We put away the stethoscope at that point and look over the skin of the horse, going from the nose on back to the tail, looking for bumps, skin masses, dermatitis, anything that appears abnormal, and make note of it. Following checking the skin, we'll go ahead and do a more complete palpation of the entire horse. And that can often start on the neck and back, and we put pressure on the various bony structures and soft tissue structures to determine if the horse has any sensitivity. An example would be pressure on the upper back muscles to determine whether it's a normal response or a hyperreactive response that is showing that the horse has back pain. We also will palpate in detail all of the limbs, looking for swellings or thickenings or extra fluid in joints. From those exams, we move to some specific parts of the horse. We want to get a look, if possible, into the ears of the horse. Oftentimes we'll use a pen light to look down and look for things like dirty material in the ears, or what we call ear plaques, which are white concretions on the inner lining of the ear. We'll also take a look at the eyes with the pen light first and look for pupillary reflex to bright light, which it should constrict when we shine the light into the eyes. We look for discoloration of the normally clear cornea, and look for inflammation in the tissues under the eyelids and on the third eyelid, looking for signs of injury or inflammation. After the pen light exam of the eyes, we use an ophthalmoscope that allows us to look deeper into the eye and see the optic disc, which is where the nerve sensation and sight information goes to the brain, and then the retina, which collects all the visual information the horse is accumulating. From the eyes, we'll move to the mouth. We judge the age of the horse by looking at the wear pattern of the teeth, and then look into the mouth for things like sharp enamel points or irregularities of the table surfaces, what we call the occlusal surfaces of the teeth, to determine whether the horse needs dental work or not. Other things we look for are body weight, which is really easy to do yourself with a weight tape, and then also record that weight and body condition score on the horse's documents and record. Also, we take a good close look at the feet and hooves, assure that the horse is trimmed well or shod correctly. Further information on hooves and shoeing would be evaluated with a detailed lameness evaluation. All these findings need to be recorded as part of the medical record or as part of a journal for the information on your horse. We want to always record the specific data, such as rectal temperature, heart rate or pulse, and then also respiratory rate. We would also record the gum color and moisture and the capillary refill time. Then we'll also make specific comments on areas that seem abnormal, such as the horse has a skin bump on the left side of his neck, or he has epaxial muscle discomfort on deep palpation. Those sorts of things are really important to track the future changes of the horse and response to treatment, if any is indicated. This information is really important for your veterinarian to know and for you to know as well, so that if your horse doesn't look right or goes off feed or has a different behavior, that you can identify that and talk to your veterinarian about the need of a more detailed examination. If you need more information or are interested in further details on physical examination, visit the SmartPak Horse Health Library